Hi there. I'm Jay Hilliard, a plan counselor with Friends Life Care. This is another in our series of retirement confidential short videos on the long term care industry. Today, we're going to be talking about Medicare and how it pertains to long term care. I'm happy to have Cheryl Proska with me today. She's our marketing director at Friends Life Care, and she's going to be talking through these different aspects of Medicare and how it pertains to long term care.
Thank you for having me, Jay. The first question I have is, knowing that Medicare has limited coverage for long-term care, many people ask the question, how will I pay for the health events that Medicare does not cover?
That is really a key question for everyone to consider. And one way to start that process of thinking about that question is to really understand what Medicare actually covers and the limitations of Medicare. With Medicare, you are entitled to 100 days of skilled care, almost always in a skilled facility like a nursing home, rehab center, things like that. But to access that benefit for long-term care with Medicare, you have to go through certain what I call Medicare hoops to get there. The first hoop is you have to be in the hospital 3 days or longer with a medical problem. If you are in the hospital 3 days or longer, get released from that hospital and need what's called skilled care, meaning physical therapy, occupational therapy, nurse changing bandages, all the things that um, are deemed skilled care. If you meet those criteria, then yes, Medicare will pay for the first 20 days of that. After 20 days, there's another criteria for Medicare, and you have to meet another criteria. People are reevaluated. And what they're looking for is signs of improvement. Are you getting better? Meaning, if someone gets to the point where they um, plateau and they're no longer showing signs of improvement, Medicare can actually stop covering someone on day 20. They can do it on day 21, 28, 45. Whenever you reach that plateau point, then you what they call plateau and you're no longer showing signs of improvement, then Medicare stops. And at that point, you go from skilled care to what they call custodial care, where people might need help with things like activities of daily living, eating, bathing, dressing, toileting, things like that. When someone goes from day 20 to 21, Medicare no longer pays 100%. They pay a portion of it, but there's a copay that they do not pay. At this point, people on Medicare have Medicare supplements. The Medicare supplement can pay that copay. So let's talk a little bit more about Medicare supplements.
So, Jay, as you mentioned, people on Medicare do also have Medicare supplements. What might those supplements pay toward long-term care?
When someone reaches the point of being custodial, which could be, as we said, anywhere after day 21, or if someone has uh, an issue where they don't go to the hospital 3 days, they would be custodial on day one. But if you meet the criteria of day 21 and you're still showing signs of improvement, Medicare will continue to pay up to day 100, but they don't pay at all. And people that have Medicare supplements, the supplement will pay that copay. But it's important to know that Medicare supplements only pay what's called Medicare approved expenses. So once Medicare stops, the supplement stops. People have Medicare supplements for things like hospital stays, outpatient services, uh, Part D of Medicare supplements are for prescription meds and things like that. And then there's a Part C of Medicare Supplements, which are the Medicare Advantage plans. These are relatively new. They've been around a few years, but they really are enhanced Medicare plans that offer things like dental, hearing, vision exams, um, and you also can bundle in your prescription plan into a Medicare Advantage plan. You have to qualify for those plans. They're only available in certain zip codes, and they're almost like an HMO. In other words, you have to be in a network and use certain doctors and certain drugstores and things like that to access them. But the important thing to understand with anything to do with Medicare and Medicare supplements are they're only there for skilled care. Once someone goes to custodial care, regardless if it's day 1, day 21, day 101, or any day in between there, once someone goes to custodial care, Medicare stops paying, your supplement stops paying. And that's really where people really need to start planning for a long-term care scenario.
Now that we know the limitations of Medicare coverage for long-term care needs, what can be done to plan ahead?
Another excellent question. And that is really what a lot of these retirement confidential videos we've been doing are people that are planners that want to plan ahead and have a plan in place, have a safety net. What are some of the options for long term care? Well, obviously, your family. If someone gets to the point where they're custodial, your family can be the one who takes care of you. For many people, they don't want that to be their option. They don't want to burden their family with that. So, financially, you can always self insure, meaning use your own assets, pay for that out of your own pocket. I think we all realize how astronomically expensive it is to pay out of your pocket for home care, to pay for an assisted living or a nursing home out of your pocket. So there are options that people can have to plan ahead. Before ever needing this type of care, the sooner you do the plan, the better. The less expensive it is, the sooner you do it. One option might be long term care insurance, which is a way of having a financial benefit available to you that you can offset the cost of long-term care by having a plan with an insurance company. That is only, however, for the financial part of this. What about the burden of the care, the quality of the care, and everything like that? That's the hidden element of long-term care, the missing piece that a lot of times people don't realize until they get into the situation. And that's when we talk about a Friends Life Care membership. Friends Life Care is very unique. They have combined the financial element of long-term care and planning ahead with the actual accessibility of a care coordinator who meets you when you first join, who starts a relationship with you when you're healthy, who gets to know you while you're healthy. And down the road, God forbid, if you ever needed care, they're the ones that arrange and tap now into our whole network of care providers that Friends Life Care has vetted and has had in place for all the years that we've been in business. That's really why people look at the Friends Life Care plan. You're not only getting the financial like you do with long-term care insurance, you're also getting access to care coordination and the ability to stay at home. Our mission at Friends Life Care is to keep people at home if at all possible. 95% of our members that are getting care right now are getting care in their home. As long as it's safe and you wish to stay at home, we can keep people at home if that's where they wish to be. But if there is an unsafe environment or you need to go to an assisted living or a nursing home, the plan financially, just like long-term care insurance, the financial benefit can go towards home to an assisted living or a nursing home. But really, our plan is dedicated to keeping people at home. The key to any plan like this is planning ahead. You need to do this before you need care. We offer plans to people as young as 40 years old, and you can buy it up until your 85th birthday. If you would like some more information about Medicare, Medicare supplements, how they pertain to long term care, about the Friends Life Care Plan, and how you might have an interest in planning ahead and getting a plan in place for you, here's some contact information that you can get in touch with us, and we'd be more than happy to do that. Cheryl, I want to thank you so much for participating in this Retirement Confidential short video today, comparing Medicare with long-term care. And thank you for joining me today.
Thanks so much for having me.
We have also on the screen a link to all of our other Retirement Confidential short videos if you're interested in that. And as always, I want to thank everyone for joining us today, and have a wonderful day and be safe. Thank you.